Hi, we are going to talk about the kidney stones. Introduction. A kidney stone, also known as a renal calculus, is a solid concretion or crystal aggregation formed in the kidneys from dietary minerals in the urine. Urinary stones are typically classified by their location in the kidney, ureter, or bladder, or by their chemical composition, calcium containing struvite, uric acid, or other compounds. About 80% of those with kidney stones are men. Signs and symptoms. The hallmark of stones that obstruct the ureter or renal pelvis is excruciating, intermittent pain that radiates from the flank to the groin or to the genital area and inner thigh. This particular type of pain, known as renal colic, is often described as one of the strongest pain sensations known.
You're about to get the tools to avoid a painful condition that men are twice as likely to develop than women. I'm talking about kidney stones. But I've got the foods you need to eat to protect yourself from ever getting these kidney stones. You're going to learn all about it in one of my favorite games we like to play here, and it's called Eat the Clock. Here to play are Phil and David. Phil, how are you? David, thanks for joining us. Now, the rules are pretty simple. On the table behind me, we've got a bunch of foods. There are 8 foods in particular. Half of these foods are really helpful in protecting you against kidney stones. And guess what? The other half will help give you kidney stones if you're prone to it. Here's the deal. You got 30 seconds. You got to pick the 4 foods you think will help you prevent kidney stones. 30 seconds. Any questions? Ready, go. Help them out. Count it down. Count it down. Count it down. Go, 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 go! 16! 10, 9, 8, 7, 6, 5, 4, 3, let's go! Very nice. Do you have any words to say, Phil? Your mouth's full. Sorry. All right, let's take David's first and see how we did. We're going to put these up here. So he picked the black tea as being helpful. In fact, it's high in oxalates. That's not a good thing. All right. Oranges you picked. Oranges are high in vitamin C. That's actually a good thing. Spinach. Put it here. Got to be careful of the head fakes in this game. And you picked beets, are one of my favorite foods of all time, but they're high in oxalates. Let's see. You got one right. One right there. Let's see if Phil can do better. So Phil loves beets also, but we learned that beets are high in oxalates. So that's not something you want. Oxalates, by the way, are get into the stones, and they're one of the key ingredients in the most common stones we have. And they actually help the calcium come together into crystals, which cause the kidney stones. Spinach, also high in oxalates. Black tea, high in oxalates. Bottled water dilutes the urine. That's a good thing. But guess what? Guess what? We got a complete tie. So here's a tiebreaker. You ready? Everybody ready? What percentage of men develop kidney stones in their lifetime? Give a number.
60.
Phil. 60.
60.
David.
45%.
Who thinks David's right? Who thinks Phil is right? Well, 12%. David is the winner. Congratulations. You win. You win all the foods that help prevent kidney stones. I hope you enjoy them. You can finish up what you started to eat.
Okay.
Now, thank both of you very much for playing.
Do I get the other ones?
You can get the other ones. You can get the stone promoting ones. We'll be right back.
Renal colic caused by kidney stones is commonly accompanied by urinary urgency, restlessness, hematuria, sweating, nausea, and vomiting. It typically comes in waves lasting 20 to 60 minutes, caused by peristaltic contractions of the ureter as it attempts to expel the stone. The embryological link between the urinary tract, the genital system, and the gastrointestinal tract is the basis of the radiation of pain to the gonads, as well as the nausea and the vomiting that are also common in urolithiasis. Risk factors. Dehydration from low fluid intake is a major factor in stone formation. High dietary intake of animal protein, sodium, refined sugars, fructose, and high fructose corn syrup, oxalate, grapefruit juice, and apple juice increase the risk of kidney stone formation.
A kidney stone can be as small as the head of a pin, almost invisible to the naked eye. But as every stone former knows, the pain resulting from this tiny crystal structure can be enormous. Inside kidney stone disease. Kidney stones, or renal calculi, are aggregates of crystals enclosed in a matrix that develop within the kidneys. They're classified according to the specific types of crystals they contain and fall into 5 major categories: calcium oxalate, calcium phosphate, struvite, uric acid, and cysteine. The most common is calcium oxalate. How is a stone formed? The first step is nucleation. Ions such as calcium and oxalate that have been filtered into the urine by the kidney spontaneously join together to form a solid crystal nidus. This is called nucleation. There are 2 kinds of nucleation. In homogeneous nucleation, crystals form around a nucleus with the same composition. Crystals of a different composition can also form around the nucleus. Organic materials, such as cell debris, may be deposited between the crystals as a matrix. This is heterogeneous nucleation. The tiny crystal formations travel down the nephron and are usually deposited at the renal papilla, where they undergo the next major phase, growth. Crystals that have already formed then begin to stick together, forming large aggregates. As we can see, crystals can aggregate very quickly. New stones are retained in the kidney, where they can continue to grow for an unspecified length of time until, for reasons that are not well understood, they are displaced and travel through the kidney into the ureter. If a stone continues to grow until it reaches a critical size, which can be as small as 4 to 5 millimeters in diameter, it may be too large to pass easily through the ureter. The edges of the stone may become wedged inside the ureter at the ureteropelvic junction, where the ureter crosses over the iliac artery, or at the ureterovesical junction. The result? Pain and obstruction, until the stone slowly passes into the bladder and eventually passes out of the body in the urine stream. In the U.S., it is estimated that 13% of men and 7% of women will develop a kidney stone during their lifetime. Fortunately, in about 78% of these patients, stones will be expelled spontaneously. But stones that become lodged in the ureter may require lithotripsy, or percutaneous or endoscopic removal. It's important to note that nearly half of all first-time stone formers will have another stone episode within the next 4 years. Recurrent stone formers are at even greater risk and may form a new stone every 2 or 3 years. But what actually causes crystals to form? Why do some crystals develop into kidney stones and others do not? One critical factor is supersaturation of the urine with stone-forming salts. Supersaturation is the driving force for crystallization. In undersaturated urine, crystals cannot form. The other important factor is a deficiency in substances called inhibitors. Inhibitors retard the nucleation, growth, and aggregation process by binding ions needed for crystal formation and growth. One of the most important inhibitors is citrate. Urine saturation and inhibitor levels explain why, in normal patients, large crystals are not formed. Their urine is not as saturated, and they have sufficient quantities of inhibitors present. But the urine of patients with kidney stones is more saturated. It may also lack inhibitors that increase the propensity for crystallization of stone-forming salts. There are two reasons for this. First, stone formers are known to suffer from a variety of metabolic disturbances that increase the amount of stone-forming substances excreted in the urine and also decrease the excretion of inhibitors. Second, a number of common nutritional and environmental factors can cause abnormalities in the urine. These factors may also exaggerate underlying abnormalities due to metabolic disturbances. Environmental stresses, for example, play a significant role in stone disease, especially factors that trigger excess water conservation in the kidney, such as inadequate fluid intake. Dehydration is a major cause of kidney stones, which is why people living in areas with high temperatures and humidity have a higher incidence of stone formation. A diet high in sodium is a double risk, because it increases calcium excretion and reduces urinary levels of stone-inhibiting citrate. Too much animal protein creates similar problems, encouraging stone growth by increasing urinary uric acid and reducing urinary citrate. Certain medications are also known to encourage stone formation or growth in susceptible patients, including common supplements such as vitamin C. There is no cure for kidney stones, but once an acute episode has been resolved, the key to therapy is simple: preventing recurrence. And fortunately, the most common stones, calcium oxalate and calcium phosphate, can be effectively managed with a combination of diet and lifestyle changes and medication. Compliance with proven management guidelines, such as increasing fluid intake and avoiding stone-promoting foods, can significantly reduce stone recurrence. Medical therapies, such as thiazide diuretics and potassium citrate, are also highly effective in appropriate patients and can reduce the need for expensive assisted stone removal procedures, such as shockwave lithotripsy, SWL. The economic burden of kidney stones is significant, with medical costs reaching billions of dollars annually. Effective management of this painful disease remains a key priority at Mission Pharmacal, the leader in innovative stone disease therapies.
Calcium. Calcium is one component of the most common type of human kidney stones, calcium oxalate. Some studies suggest people who take calcium as a dietary supplement have a higher risk of developing kidney stones. In the United States, those findings were used as the basis for setting the reference daily intake for calcium in adults. Supersaturation of urine. When the urine becomes supersaturated, when the urine solvent contains more solutes than it can hold solution, with one or more calculogenic crystal-forming substances, a seed crystal may form through the process of nucleation. Heterogeneous nucleation, where there is a solid surface present on which a crystal can grow, proceeds more rapidly than homogeneous nucleation, where a crystal must grow in liquid medium with no such surface, because it requires less energy.
Kidney stones are hard stone-like lumps that can form in your urine. They are common and occur twice as often in men as women. Let's look inside the body to see how the kidneys work. The kidneys are two bean-shaped organs located near the middle of your back. They work as a filter, removing waste products and excess fluid from the blood, and returning clean blood to the body. The waste products and excess fluid become urine. It travels through two narrow tubes called the ureters to the bladder and leaves the body through the urethra. If there is an imbalance in the waste chemicals in the urine, crystals can form, which may build up into stone-like lumps. These are known as kidney stones. This can happen for a number of reasons, including not drinking enough water, a diet high in protein, or health conditions such as kidney disease. If kidney stones are small, they usually leave the body when you pass urine. However, larger stones can get stuck in the kidneys or pass down the ureter, causing irritation and blocking the flow of urine. This often results in an infection and intense pain that is felt in your back. Kidney stones can sometimes be treated with fluids and painkillers. However, if infection develops or the urine flow is obstructed, further treatment may be needed. Your doctor will advise the treatment best suited to you. In shockwave therapy, shockwaves of energy are used from outside of the body to break up the stones into small pieces that can be passed out of your body in urine. In percutaneous nephrolithotomy, a small cut is made in your back, and a thin telescopic tube is passed into your kidney. The stone is then either removed or broken into smaller pieces using a laser. A ureteroscopy is used if a kidney stone is stuck in your ureter. A thin telescopic tube is passed through your urethra and bladder and into the ureter. The stone is then either removed or broken into pieces with a laser. If none of these methods are suitable, the stone may need to be removed using traditional surgery. If you've had a kidney stone, there is a risk of getting another one at a later stage. Your doctor will be able to advise you on medicines and changes to your diet that can help prevent further stones.
Diagnosis. Diagnosis of kidney stones is made on the basis of information obtained from the history, physical examination, urinalysis, and radiographic studies. Clinical diagnosis is usually made on the basis of the location and severity of the pain, which is typically colicky in nature, comes and goes in spasmodic waves. Pain in the back occurs when calculi produce an obstruction in the kidney. Physical examination may reveal fever and tenderness at the costovertebral angle on the affected side.